All right, I'm just going to read out the next list. I think it's April Dunn, Amy, Jamie Duplessis. How would you say that? Donarski, Amy Donarski, maybe. April Dunn, Jamie Duplessis, Lorraine Phillips. If y'all want to those four want to head down, and if that's all part of one group, that I'll be calling the next group the next after this. So, just to give everybody a heads up. When you're ready.
Good morning, Mr. Chairman and members of the committee. My name is April Dunn, chairperson of the Developmental Disability Council. Thank you for letting me speak today. We have a lot of people in yellow shirt and many more who couldn't be here but are watching from home. We all need the same thing, funding for services for people with disability so they can live at home and in the community where they belong. We are asking that you add money to the budget for several things. First, to restore provider rates for the DD and aging population to year 2008 levels so our direct support workers can make a living wage and have enough money to pay their bills. Second, to implement TEFR to help families of kids with disability pay for their high medical costs. Third, to serve the people on the waiting list for the state personal assistance program so they can work and stay out of nursing homes. And four, to provide more equitable funding to the two health and service districts and authorities with the lowest per capita state budget. There are some people here with me today who are going to tell you how each of these issues impact their families and let you know why all of these issues are so important. Thank you.
Thank you, Ms. Dunn. One question. Thank you all. Representative Bacala.
Thank you, Mr. Chair. I just speak to your point. I think when, first of all, you spoke to you couldn't find providers because they don't exist. I mean, we've overloaded that system. And the second point I think some of y'all have shared is when you finally can get somebody, they don't stay long because they go find another job. So there's, as soon as these disabled children maybe get comfortable with a provider, they move on, and you have to start all over again, and you have to train that next provider and show them exactly what's needed. Can you kind of expand upon that, because it didn't come up, that continuity of care and how important that is, and you haven't been able to retain that?
For me, I had so many different workers, and some of them I have to let go because they wasn't taking care of me. They wasn't treating me right. Like I'll give you an example. One worker left me in a car with the motor running by myself. My mom reported it to that provider, and that provider pressed charges on that worker, and that worker got arrested for necking me and abandoning me. And having so many different workers, I had to train them and tell them what my needs are, and and it's very difficult, and I just don't want to go through all of this again. So I'm just asking you guys to please restore the provider rate to 2008. Thank you.
And if I may say, from the support coordination angle, we see it as well, that you will see someone that has better health care, that has, with the continuity of one DSW staff, you can go in a home and tell when somebody's had their staff for 12 years. They're kept cleaner, their self-care is better, their house is better, their entire situation is better. It definitely leads to less falls, less incidences of problems with the bowel program. Our folks need such specialized care that when you're constantly having turnover, that it definitely affects inpatient ER visits and all of those things as well.
Thank you. And you know, again, I say this often, y'all are competing against other entities within the healthcare arena. And nursing homes are guaranteed an increase every other year. They never go down. That's by law. And you guys are you know, you're just trying to stay level. And that's just an example of the disparity that we at some point in time we need to have the courage to address. Thank you.
All right, board is clear. Thank you all.